Hello, namaste. I'm Dr. Shelly, and today we'll talk about a remedy, Senega. And ये remedy पे how I arrived and how easily we can miss this remedy. I'll share with you all a case where I gave a remedy, I failed, then I did some observations and I came into conclusion with Senega and how frequently we miss this remedy. So there was a patient, he came to me 4 to 5 months back with chronic bronchitis. He had asthma, he had breathlessness, and then he had watery discharge from his nose. So I'll just tell you in short about his totality. He was a very hard-working person, very industrious, right? At a time he was doing 2 to 3 business. He never had time on Sundays, etc. He had watery discharge, which was copious watery discharge with burning in the nose. He gave me a symptom, ma'am, I feel as if there is mirchi, there is pepper in my nose, it's so burning. Whenever he coughed, he had pain in back. He was a very irritable and quarrelsome person. He had constipation, his chest complaints always altered with his gastric complaints, right? And most importantly, what I observed in that case was that always, he was very irritable. He easily get annoyed, but obvious we all will think of one remedy, which is Nux vomica. I gave him Nux vomica. 2 months no relief, 3 months no relief, and then this made me think, should I have a lateral thinking about this case? So a patient came to me last month again, and then I got an observatory symptom. So see, this is the importance of observations which you make in your clinic. So patient just showed his chest when I was auscultating him, and he said, ma'am, I always get this red spots in my chest after bronchitis. So this was a very strange symptom, there was a circumscribed red spot in the chest after his bronchitis. So this clicked me, like this is an entry to my remedy, and I would like to recheck if this rubric covers Nux vomica or not, right? So I checked the rubric and I arrived to a remedy, which is Senega, right? So there's a symptom or there's a rubric, circumscribed red spot in the chest after inflammation, and the whole picture was clear. Senega was so much similar to Nux vomica, I cannot tell you. And I would have skipped Senega for him. I gave him Senega 1 dose last month, and I got his follow-up, and he was much better. His intensity of complaints decreased, his stamina was much better, etc. So let us talk about Senega in short. We don't have much time. So Senega basically is a remedy which is very hardworking, very industrious, right? The common name is rattle snake root. So उसका नाम कहाँ से आया है, rattle snake root? So Native American people called as Senega, they used to treat snake bites with this herb, and so the name came rattlesnake root. Okay, now this remedy nowadays is used in cough syrups, it is used in tea bags, etc. etc. It is still used in a lot of respiratory complaints. So let us understand what is the homeopathic approach, or what is the homeopathic understanding, deeper understanding of Senega. Superficially तो हम prescribe कर ही देते हैं आई complaints के लिए, respiratory complaints के लिए, but हमको उसके deeper aspects understand करने हैं, so that we can cure a disease with Senega and not just ameliorate it by understanding the superficial symptoms. So let us go into the Senega. Let us dive deep into it. So basically Senega is an industrious remedy, right? It is a very irritable remedy. Like, he is always having respiratory issues. Along with that, he is a very irritable person. He gets irritable on little things. He's a very angry person, and you will always see an alternating state, anger alternating with cheerfulness, irritability alternating with cheerfulness. Again, this is a mirror image of Nux vomica, right? Now these people easily gets offended. They are very abusive people, same like Nux vomica, highly abusive, easily getting offended, very quarrelsome. This is one of the most quarrelsome remedies of our materia medica, right? Now These people are very anxious. Now this is how we differentiate between Nux and Senega. Now Senega people are very anxious. Whenever they have anxiety, they are better whenever they are moving. Anxious, if there is an acute case, patient is very anxious and he is just moving about. You have to think also about a remedy which is Senega, because Senega is anxiety better by motion. Now, what are the other remedies which are better by motion? One is arsenic, Actia spicata, Kali iodatum, okay, Taraxa. These are the remedies which is better by motion, and whenever he is sitting, he is resting, his anxiety increases, like iodum, Actia spicata. Okay. Now, if you understand, they are very hopeful people. They are very they have a very good memory. They have got very acute memory. They're very sharp people, sharp-minded people. So there's a symptom in which Dr. Boric says that all of a sudden he recollects some places which he has seen long back. Like he will say, "Acha, 70 years back I had gone to that village and that lane, I suddenly remember." So they will all of a sudden remember these things. Okay, that is why this remedy is also given in herbal form for memory loss, dementia, to increase the mental capacity. And this remedy is useful for people who are very active. They have a good mental memory. Now, understanding the particulars. This remedy affects mostly in your eyes. We all know about it. Unfortunately, we have eye drops in homeopathy, which is very pathetic, which we should not use. Fine. So it is used for eye complaints. It is used in respiratory. Its main action is on bladder. Right? Now, eyes. This remedy promotes absorption of fragments of lens. This is a very good remedy you can think about giving after the surgery of your eye. If you do any surgery of eye, think about this remedy, which is Senega. In respiratory complaints, this remedy as having chest complaint which is alternating with diarrhea. They are highly constipated people, right? They have rattling chest. Whenever they have cough, their cough will always hurt the back, like Nux vomica. Okay, now, and it has an affection especially on the mucous membrane of the eye, of the respiratory tract, and in the bladder. Acting on the bladder, this remedy causes albumin in the urine. They have chronic cystitis, the urine increased mucus discharge from the urine, right? They have uncontrollable urine. Now, modalities: aggravation by touch, rubbing, pressure by rest, better by bending head backward. This is the PQRS symptom. All the complaints of Senega, especially the eye complaint, are better by bending head backward. And completely bending better ameliorates dysphoria, better by sweating, and better in open. So this is in short about Senega, and hope it was very useful to you. And use this remedy. Think about this remedy in a parallel aspect, and do let me know whether this thing which I shared with you was useful or not. Thank you so much.